Good morning. I am Kathy Kelly, Chair of the Manhattan DD Council, and welcome to our meeting. We will start with any announcements. If you have an event or openings, please feel free to raise your hand. And I will call on you as we get those up and running. So Wendy?
Good morning, everyone. Just wanted to say Adopt Community Network has funding available for all 5 boroughs for family reimbursement. So if you have not gotten your family reimbursement applications in, please do so as quickly as possible. Typically, we'll receive those until mid-June, just to give us time to process applications and be able to get people's reimbursements out within the fiscal year. Also, we offer housing assistance services, home modifications, community rehabilitation, rehabilitation clinic services, and so on. Lastly, I wanted to mention we do have a workshop coming up tomorrow on our home modifications program. So if you or someone you know requires home modifications, whether they are OPWDD eligible or not, there are different grant opportunities to cover whether you are someone with OPWDD eligibility or if you are just considered medically frail or specific grants for elderly and so on in New York City. I will be posting that information on the chat. So please call or email Project Connect for any of that information. Our Project Connect number and email will also be in the chat for you. Thank
Great.
you.
Thanks, Wendy. Chris?
Good morning, everyone. Christopher D. Grive from the ACTA for Accessibility to the Transit and New York City Transit Riders Council, as well as the ADA Task Force for Long Island Railroad and Metro North. The very important announcement to make is as we're getting ready next month to get ready to start the phase of switching from reduced fare MetroCard to the Omni reduced fare, which I will be putting that onto the chat as I'm doing right now. So we're reminding everyone who has a reduced fare MetroCard today, it is very easy to do this procedure. The attachment information is there. It is very simple, very easy to do. And this is to start the switching. You don't have to switch as of June. You have from this June to 2023 or 2024. By then, will be no more MetroCard. It will only be the reduced fare Omni card. The Omni card will give you access not just on subways and buses, but Long Island Railroad and Metro North. We'll also have an accessorized Omni card that customers who have accessorized today will receive that card when the test is done. Right now, they just started doing the test for the accessorized. Once that test is completed, there will be a letter going out to all accessorized customers. Also to remind you, we also still have in the border between Bronx and Queens that buses do come into Manhattan are doing the redesign. Bronx will be done as of June 26th. So please make sure if you're using the buses anywhere from 125th Street going up to the Inwood area. Some buses may be changed. Some buses will remain their same routes and stops may be changed. Reminding you, for example, the M100 bus that normally goes to where the First Avenue is will no longer go there. The last stop will be to an accessible train station, which will be the A, B, C, D, and 125th Street. Other lines will be still the same. But please make sure you visit the MyMTA website for redesigned stuff. And to remind you also, you still have to wear your mask on the bus, on the subway, and especially on Accessorize. Please make sure that if you cannot wear a paper mask, the CDC does say you can wear a washable mask. If you have severe asthma, certain heart conditions, or when it's really hot outside, washable masks are much more safer and will help you to breathe a little better. You do not have to wear the mask in outside stations until the train arrives into the platform. Indoor stations, you must wear it at all times. If you have any questions, please put it into the chat. I will be here for the rest of the meeting. Thank you.
Thank you, Chris. You do give the best MTA updates, and thank you for keeping us all updated on all of those changes.
Oh, and I left out one thing. Yesterday, Times Square elevator, we have another new elevator opening, just opened yesterday at Times Square 42nd Street, right near the shuttle. So have a chance, go down and enjoy the beautiful art there as well.
Thanks, Chris. Jay?
Good morning. Oh, sorry. Okay. Good morning. Jay Kleinman from LifeSpire. We have openings in behavior management and parent training for Manhattan families. So anybody interested in that, just feel free. I've put my email in the chat. It's jcleinman@lifespire.org, just the letter J. And my phone number is 646-338-5632. Okay, thanks.
Thanks, Jay. Johanna?
Good morning, everybody. Joanna Santana from Synergia here. I just wanted to say hi to everybody. I also wanted to share that I'm celebrating today my 20th anniversary. So it's a happy day for me. Marriage 20th anniversary. And I also want to let you know that we have a lot of openings for families of reimbursement and also evaluations. Please, I'm gonna put my email and phone number in the chat. Feel free to contact me and I will be happy to guide you through the process. Thank you.
Thank you. Samantha?
Hi, this is Samantha from IAI. I just wanted to let everybody know that we do have openings for Manhattan residents in our free evaluation grant for those who do not qualify for Medicaid.
Thank you. Any other announcements? Go ahead, Wendy.
Yes, I just wanted to mention if there's any agency representatives that have not received an email from Jasenia regarding update to our Manhattan Family Directory, please email her directly or email Kathy or any one of us on the Manhattan DD Council committee for the directory, and we'll make sure that your agency information is updated. That's coming to a close very quickly, and we want to make sure that as much information about the agencies that provide services to Manhattan residents are included in the directory. Thank you.
Thank you, Wendy, for that. I just want to add, hi, this is Yesenia. I just want to add that this is the last week, actually. The directory will be going out this week. So if you have not sent me your updates, unfortunately, your agency will not be updated for this year's directory. And I will be providing my email in the chat, so you can email me with any updates. Thank you.
Thank you, Yesenia. And a huge thank you to Yesenia for taking on this task of having the directory updated. Couple of DD Council, just general updates. We are going to have the directory translated this year. So we are working on having that translated. So that's even more of an incentive to get any updates or changes into Yesenia as quickly as possible. Also, just general DD Council updates. We are going to be having a family support fair. It will be virtual. I think we're all hoping that we would be able to pull off a live event this spring, but every time we think we're getting close enough to that, there's another surge. And getting venues that are willing to host a large scale event is still very difficult at this time. But we will be having a virtual event on June 14th from 10 to 2. So look forward to those save the date and registration information, which will be coming out shortly. Any other announcements?
Kathy, I have a question for you regarding the fair.
Sure.
I like to be part of that fair because since we are getting ready to switch from reduced fare to Omni, because a lot of the families and individuals and seniors, need to know how to do the transfer. I can, make sure we can set that up with the team.
Yeah, Chris, we have our workshops set at this point, but what we will be doing is kind of like having some video clips in between. So let me talk with the committee and let's see what we can do to accommodate that.
I'm sorry,
Wendy?
Kathy, just wanted to jump in here and just say, there was an email that was sent out yesterday evening from Nicole Pagano indicating to all the agencies and companies that were vendors in 2019, because that's the most updated list we had, just indicating that what we will do is give every agency an opportunity who wants it, an opportunity to submit 3 slides with information about their particular agency. That could be your logo with some information about particular programs that you want to share. If you did not receive that email, please email me at wdeleon@adapt. You know what? I'll put it in the chat. Usually the spelling of that is, I'll put my email in the chat. Just send me an email and we'll forward you that email with the directions and so on.
It's 2 super quick things. One is that last night while I was stressed out,
Thank you.
Adam, the groom for the wedding, that was my friend's wedding.
What Tom is saying is completely different from what I was saying. Just,
Thanks, Wendy. Anything else? No more hands raised. So let's move on to New York City DOH MH updates. Gavin?
Hi, good morning. I just wanted to provide a few updates on COVID. At this point in time, as you may or may not know from our last meeting, we do have a new COVID alert level system and recommendations for each level. The alert level system is really designed to provide like a clear, set of information to the public so they know what's happening with COVID, what kind of precautions to take and so forth. Currently, the alert level is yellow, which is medium, and that means there is increasing spread of COVID in the community, but it's not, there's actually, low, medium, high, and very high. So we're sort of in the medium at this point. And I'll include a PDF in the chat so that people can see like what specific recommendations they should be taking based off of a medium spread or a yellow alert level. But I can tell you that the main difference between the green and the yellow is simply to consider wearing a mask in crowded indoor spaces. So if there is, a large event you're attending with a lot of people, then the recommendation is to consider wearing a mask inside in that setting. In addition, currently the test positivity is around 9% and increasing, 9.11. And that's one of the ways that we measure sort of spread in the community. It's the number of tests that are coming back positive. And as the number is higher, it means that the spread is generally higher as well. That's for the past 7 days. And currently we have about 3,472 cases as our average for the last 7 days per day. I also will include a COVID test locator in the chat. And as you know, COVID tests are available in many places, including pharmacies, but it's useful to have some of those links. If you do test positive with an at-home rapid antigen test, obviously, isolate immediately, but I'll also include a connection to care phone number as at this point in time, you can see your primary care doctor, but you may also, not be linked to care. So it's important to have a number to call for that. I also want to kind of go through a few of the COVID treatment options, which are very, very important to know about at this point in time. There are 2 sort of groups of treatment options for people who test positive for COVID. The first is a monoclonal antibody treatment. And this is a one-time IV or injection to help give you antibody protection while your body works to produce its own antibodies. And this treatment is covered by Medicaid and Medicare plans at no cost. If you have private insurance, just check with your provider and health plan. But many providers do, or I should say many health plans do cover monoclonal antibodies. With respect to the other category, there's 2 antiviral pills. And these pills need to be taken daily for 5 days, and they basically stop the virus from replicating. And these reduce the amount of virus in your body. And the FDA has authorized 2 different treatments, as I said, to treat COVID. The first is called Paxlovid, and the second one is Molnupiravir. And both of these treatments are currently free. And I'll include as well a link to those, to more information about those treatments if you're interested. And many people have asked about the second booster shots, sort of who's eligible and when you should take those. At this point in time, a second booster is recommended for everyone, or sorry, I should say a booster is recommended for everyone 12 and older who is fully vaccinated. However, a second booster is also available for certain groups. And those groups are all people who are 50 and older, people who are 12 to 49 who are moderately or severely immunocompromised, and also a third group, which is people who are 18 to 49 and received a primary and booster dose of the Johnson & Johnson vaccine. So if you are eligible, you can get the second booster shot about 4 months after your first booster. And the second booster must be either Pfizer or Moderna. And then finally, we are still offering, free in-home vaccine. And so if you need to schedule free transportation for that, I'll include sort of the online sign-up form. If you're interested in having an in-home vaccine, there's an online process. You can also call a phone number, which I'll include in the chat as well. And this is, we also obviously you can get transportation if you need it as well to a site if you're interested in that. And those are my main updates. As I said, I gave it a lot of information, but I want to include some of these links in the chat and so forth. But the main takeaways are that, of course, COVID is here. We have medium levels of transmission, and certainly the treatments, monoclonal antibodies and antivirals are sort of the main things that we're looking at to treat COVID if you do test positive. Thank you.
Thanks, Kevin. State news update, James.
Hey, good morning, everyone. I'm just going to go through probably 5 to 10 minutes worth of updates. I'll start with a general comment that masks continue to be required in OPWDD certified programs and facilities. And we've issued a FAQ document that provides additional guidance on masking. So I will put that link in the chat. Since the last meeting, our commissioner held a town hall event for DSPs. And, she wants to, one of her goals is to establish open communication with DSPs and understanding, some of their needs and concerns. So that did occur. The event was recorded, but as I understand it, there may have been a technical glitch with the recording. So if they can work that out, the recording will be posted to our website. But they're also in the process of working on a questions and answers document related to the event that will, if the recording isn't posted, that will definitely be up there. We may have covered the budget to some extent in the last meeting, but I'll just mention briefly, some of the highlights regarding the 2022-23 budget is that there was a 150 million that was allocated for the 5.4% cost of living adjustment. The recruitment and retention bonuses were also funded. There's a 30 million in state share for to provide minimum wage increase for staff in the nonprofit sector to continue towards the $15 minimum wage. There is 23 million in housing funds to address the cost of developing and accessing and maintaining housing opportunities. And there was specific money allocated for to help bolster the rent subsidy program. So that was previously known as ISS. So there was approximately 13 million, which was 22 million annualized for that. There's also going to be some additional funding for admin fees for those agencies that assist individuals in accessing ISS apartments. There was 10 million to restore the room and board reimbursement levels for ResHab providers. So, you know, there was some the possibility that would be eliminated, but that was not, and there was funding to help maintain that. There's also additional 15,000 or 15 million to expand the availability of affordable housing. Also, there is some funding for crisis services. So there is a 30% rate increase for intensive behavior services. And there was some funding to improve county-based, or in our case, borough-based crisis services in the amount of $3 million. Let's see, there is some additional funds to establish the Office of the Chief Disability Officer, and that is actually new. And the goal of that division is to help bridge communication between the different state agencies related to people with developmental and other disabilities. The other quick update I was going to give is on the 507 plan. I know we've mentioned it in a number of meetings in the past. This month the draft will be released for public input. Next month in June, there's going to be 2 virtual sessions, and an announcement will go out with the date of those sessions. Majority of folks that participate will be remote, but there will be some people who may speak, who will go to, it's likely going to be held at the Beaver Street, Manhattan DDRO for those people who are going to deliver their comments. And then in the summer, there's going to be regional in-person forums to collect information from the DD councils and other stakeholders. And then around November, that plan, the final draft will be submitted to the governor and legislature. So I will also put a link to, for folks to be able to give their input. The address is planning@opwd.ny.gov. But again, I will put a link to the 507 plan initiative, as well as the email address for folks to send in, their comments. There will be an opportunity for, if there's anyone that wants to speak, there'll be an opportunity to submit a request to speak along with, the particular issues that you want to raise. So look for that announcement that's going to go out. And those are my updates. I will unfortunately have to leave at 11, but Nicole Lopez, who is a part of our regional office, is on the meeting, and she can answer any questions that may come up after I leave. Anyone have any questions? Okey-doke. Thank
Quiet
you.
group today, James. Thanks, James. IEC update. Tom, I know Tom and Chris are here, so
Yeah,
what's the coin, guys?
yeah, I'll do some of the OPW and other advocacy updates, and Chris could probably report on education. But James, I do want to just confirm that the town hall that Commissioner had with DSPs were for the state operated direct support professionals only, correct?
You know, that's what it was initially, Tom, and I thought at one point it was opened up to voluntaries, but I could be wrong about that. So,
Yeah, I think the commission said she might consider doing it for the voluntary agencies, but this one was just for the state house.
okay, yeah.
Yeah, how are people selected to be part of it? I mean, anyway, and when did it happen? And you know, what happens to all the other people who had comments and stuff? So to Tom's point, great.
Great. I think Ellie, the commissioner, did say that they're collecting information, and if there seems to be
A need for another.
a need for a voluntary session, that they'll do that. So I will relay that up the chain.
Thank you.
Okay. I first want to just begin on and speak a couple of seconds about what happened in Buffalo. You know, all our hearts are deeply saddened by those events. This happened this past weekend. You know, Buffalo is a mid-sized city, but it's really more like a small community. It seems as if everybody knows everybody. And I wanted to, I reached out to a couple of providers that we work with, our colleagues out there, to see how they were doing. And I got this short statement that she sent back to me, and I wanted to read it to you. We have an apartment building with 18 OPWD set-aside units, 2 blocks from the top supermarket. A group of us were there in the morning doing a community cleanup. An incredibly uplifting event, marred by this awful tragedy a few hours later. None of our tenants were at the market, but we had staff who had family members who were killed and others that survived. The stories are harrowing. We, as a nation, as a state, as a community, and as our community, supporting people with disabilities, we certainly see and hear what happens, the violence, the inhumanity, the racism. We do what we can, certainly in our community, and it just keeps reminding us of what the challenges are in the larger world, and why we keep advocating and stay strong for our community. Our hearts go out to those who are still suffering from this. So from there, I just want to also, in terms of the news, just as folks probably know that we're still in the midst of the gerrymandering debate that's been occurring in New York State. The redistricting is really leading to a lot of confusion and an awful lot of back and forth. It appears as if the assembly districts have been more or less settled, but the Senate districts in New York State were just thrown way off. What had been 6 competitive seats that was estimated by some of the political analysts out there, there are now 16. So there are people, certainly as in Manhattan, the congressional district, we understand that both Jerry Nadler and Carolyn Maloney are living in the same district or the same redistrict. So there's going to be quite a good deal of infighting going on. We have the 2 primaries coming up. And for our legislators in Albany, this is going to be a lot of stuff moving around. There's legislation that is probably going to move very quickly over the next couple of months. And so we're going to keep an eye on that because that's obviously might affect advocacy in terms of who we have to talk to, who we need to bring up to speed, and who we can count on and not. So I just want to bring that to your attention. As far as we're concerned, I think some of the updates in terms of, I think James mentioned some of the increases that were, passed, and that was certainly a good thing, but our fight continues because for DSPs, we need to continue to advocate for wages. We're looking at ways to continue to uplift those. We've had these benefits of the bonuses, but bonuses, as we all know, are not permanent. We are very, very fortunate and pleased with what the governor has done. She has been very, very supportive of us. And for that, we need to continue to work with her office as well as our legislative champions to move this again as we approach September, which is going to be, the new legislative session. And even as there may be some lame ducks coming up in November, we will have obviously be making new friends as January rolls around and the governor's budget is proposed. So there's a lot of work to do. It seems as if you could always take some time off, but with the primary coming in June as well as in August, work continues. So we have that. I think James mentioned the 507 plan. What we heard as of yesterday is that it's being translated into multiple languages this week and it should be ready for release next week. And they still intend to have at least two virtual statewide as well as in-person sessions. They're going to take it on the road. They're going to hear public comment. They got to get it back to the legislature by November. So be on the lookout for that. It should be released, as I said, hopefully next week. There is a new proposed 1115 waiver seeking $17 billion to address health disparities across populations exacerbated by the pandemic. The commissioner asked us to respond to the waiver to send to the Department of Health that the IDD community needs a seat at the table. Some of the areas they're talking about are movement from community from institutions, supportive housing, workforce development, things along those lines. So, IEC will also be, putting in a statement that we do need to have a seat on the table and that we do need to talk about, where we are, especially in health disparities. I think, individuals and families know very well how hard it is to find proper clinicians, proper practitioners, proper doctors that understand the needs of a person with disability. So that'll be part of what we need to bring forward. Side note for providers on the call, especially day providers, the to from transportation rates that affected the day hab rates beginning July 21 is now being worked on. There was a great loss of transportation dollars because they included 3.5 months of the pandemic as a base rate for day hab transportation for this fiscal year 21-22. So the commissioner is working with us on that one. She showed great ability to get it to have a pause so that we can have a firmer look at it. Obviously, pandemic times were unique and we're challenging, and there's no, we're certainly arguing that there's should be no way in which a provider would be penalized because of the lockdowns that were in place. So, so again, she's been great in terms of taking that on and trying to work that through. We still have no resolution to some of the issues and problems at self-direction. We had asked, we understand that there was some limitations that OPWDD has, especially in terms of contracting from the state controller's office, because we understand that there are contract and budget issues. There's contracts issued to a fiscal intermediary for 5 years, and the budget sometimes is already spent out within the next one or 2 or 3 years, leaving no money in the rest of the contract. So these are issues that they're trying to wrestle with now. So we're hoping to get an update by next month and a little bit more of a dialogue back and forth between the FI providers and OPW. So the cost of living adjustment, again, James mentioned all those things and the rate changes that are coming. We did get a formal Appendix K approval for the proposed residential cuts that were going into effect back in from October 20 to May 21. So they were officially deferred, which is a good thing for us. That was a battle that we had over the past 2 years on that one. The new rate methodologies were probably not going to be ready before the end of this year as well. That's pretty much it. There's, I know that there are new survey processes that are much more streamlined that are coming as well. And the housing subsidies that were passed during the last budget will probably take effect by October 1. That's when they're going to be basing rental and lease payments on the HUD guidelines. That should take effect in October. And I'm trying to see, I don't think there's anything else of note. Yeah.
Ellen, you had a question?
Yeah, Tom, you used the words officially deferred.
That's a
What does that
Medicaid. It's a Medicaid term. Basically, that's what they use.
That means it can come back and bite you at any time that.
No.
What do you mean, no?
No. I mean, no.
I don't believe you, because you're not speaking.
I'm shocked that you wouldn't believe me, Ellie, really. No, what happened is the new
Means
rate
it can come. What?
The
Sorry.
new rate reform methodology is going to be put into place. So it's deferred until all of that. And then now how the new rate methodology is going to work doesn't necessarily mean residential cuts are going to be snuck in there. But by the same token, there's a whole new methodology that's going to be in and around, that relate to based on DSP wages and all kinds of regional issues. So that's going to be, so it's deferred until that point in time, and then it officially gets redone. The rate reform gets redone. So no, it's not. Again, it's a Medicaid term. It's paused. It's deferred. That's how they capture it.
It can't
I know. You did say before you were cynical. I think that's the word you used.
Yes.
Yeah,
All
no,
right, so-
but it's not. It's done. It's done for. It's
Okay.
just obviously that's how they have to frame it.
So my other just question is, so everybody's got all this money and it's sort of flowing through, but is it really? I mean, are the providers actually seeing whatever they should?
The
And
monies have come through, but this is so much stuff with it. For example, many staff are having difficulties because it may affect their income eligible programs that they're a part of, and they're getting this giant check. And then there are other issues where a provider, because they get a lump sum payment that comes into their direct support services category as an expense. If anybody knows accounting, that has to be ratio valued to the administration, which makes a huge charge in administration, which will knock people over the limit. So we're telling OPWDD, we shouldn't be penalized for this because it's basically a pass-through. It's not a traditional expense, but it is an expense. Yeah. So therefore, they're trying to work that one out as well. There's all kinds of administrative headaches for a great cause, and we'll take it. But it really is taking a lot. And of course, the providers have up to 180 days to distribute all of it. You have to begin with at least within 90. So there each agency is developing their own expenditure plan to be able, and a communication plan is hopefully already in place to let the DSPs know what's going down and how long it's going to take and what their attention is. So I think most have done that already. But
What was the date from the 180 days? Do you know?
I believe it's the date they got it. So I think it's late March when the checks were distributed.
And everybody's on the same page, like all
Everybody
agencies?
statewide, yeah.
Okay.
Yep. Yeah, you sign, agencies sign the attestation, and that acknowledges that 180 days from receipt. And then there was, now, some of the payments have not gotten in, the workforce incentive bonus, and that's the $1,000 or $500, as well as the COVID vaccination bonuses. We're still waiting for those. For those staff that work in PHP or the FIDA Advantage programs, that money has not flowed yet because they have to go through CMS since it's a managed care program. So that has to be worked on in terms of the administrative technicalities that have to be worked out prior to it. So it's a massive, administrative, challenge.
Jackie, you had a question or a comment?
Yes, I had a question for Tom. When you were talking about the 5-year contracts with the FIs, that's a contract between the FI and OPWDD?
Yeah, and to work with the families to provide their self-direction budgets, yeah.
And are those contracts all on a different timetable? So each FI is rolling in a different way?
Yep. Mm-hmm.
Okay, thank you.
Depends when the folks come in, as people come in the door. And of course, this is a program that has really taken off and on and off, but and they want this to work, but there's so many glitches in it. But the 5-year issue is really a state controller rule. It's not OPW's. So, they get audited too. And a lot of times these programs come out looking very clunky and very difficult to navigate. And a lot of it is because that's what state law is, and they have to respond and stay under it. So I think they're trying to find ways to see how can we amend contracts. You can't have no bid contracts. Oh, we're just going to have a contract with Mrs. So-and-so or Mr. So-and-so, and here it is. But so there's certain guidelines that they just can't waive, that they need to adhere to, and it makes it a headache, to be honest with you.
Okay, thank you.
Sure.
Anything else for Tom? And Chris, I believe you may have some education updates from IUC.
Sure. So thanks. Yeah, I'm just quickly. So we do have 2 bills in Albany that we're right now watching that we hope will address the concerns we have about the 11% that the governor has dedicated to our schools. One of the issues was that with the way the tuition rate methodology is currently, if providers aren't able to spend that money, and I think I've said this to the committee before, they basically recoup all the money back. So one of the bills, Senate Bill 9132 and Assembly Bill 10191, would require that the rate reconciliation that takes place only takes place after the providers are able to put money into some sort of a reserve, primarily to make sure that they're able to pay for teachers that they need, but right now can't hire, because that's a lot of the money right now that the schools have that they're unable to spend. And then Senate Bill 9134, Assembly Bill 10192. These were just introduced last week. That would allow all schools to receive the 11% increase. Right now, schools that have a tuition waiver in will not get any increases. So we really need to make sure that that bill passes, or that something is done to address the issue of interim plus rates for our schools. So those are two bills we're watching and strongly, supporting. We have letters that we're going to send out that schools will sign on, and then on our website there's there's a advocacy link where parents and staff from the schools can click on it and send a letter to the governor. So we're trying to push that forward. I'll just give you some update. We did a survey recently of our schools. We do a staffing survey once a year to kind of see what the status is of the schools. We did a survey in October of 2021. Then we redid the exact same survey as of April 15th, same time frame, 6-month cycle. And we wanted to know what the situation looks like in terms of staffing and how many classrooms are not currently open. So what we found out in this new survey is that there are 126 preschool classrooms, state-approved programs. Those classrooms should be open that are closed because our schools do not have teachers. They can't operate them. In New York City, the estimate is that they needed almost 900 seats. Here's your 900 seats right here. They're all closed. And they're not going to open anytime soon because of the inability of providers to recruit teachers. 100% of all of our schools, we have about 40 agencies that responded to this survey. 100%, every single school said they're getting fewer resumes or no resumes at all for teachers. And the other just sort of snapshot to give you an idea. So we're talking a 6-month window, right? So in October 15th of 2021, the vacancy rate for teachers in our schools was 33%. In our 4410 preschools, the vacancy rate now is 42%. In 6 months, it's climbed 9%. And for school age, it's even worse. School age, the vacancy rates in October 15th of 2021 was 29%. It is now around 50% in our school age programs. And our schools are still losing teachers to the public schools. Even last week, some of the schools reported losing teachers. And I think the most concerning piece of this is that we know from survey data that we've done for many years that our schools lose the bulk of their teachers and staff between the middle to the end of August until approximately early October. That's traditionally the cycle. However, every year until this year, our schools go into that cycle pretty close to fully staffed. If our schools go into this cycle with a 40%, 50% vacancy rate, September is going to look very, very, very difficult in New York City for kids to find seats because they're not going to be able to operate classrooms. So we're strongly advocating for salary parity in New York City. On May 25th, there will be a general budget hearing on the final budget. And we are going to be encouraging our providers to provide testimony. I testified at the preliminary budget hearing. I will be testifying on May 25th. We are going to strongly advocate for salary parity. The city council, in their response to the mayor's executive budget, included $30 million for salary parity for our teachers in the 4410 programs. Every other teacher in the city receives the same starting salary as public school teachers, except our 4410 teachers. And that's just not acceptable. So we will be strongly advocating for that to make sure that the 30 million appears in the final budget this year. Last year, we were close, but it was removed from the final budget. And we are going to strongly advocate that it remains there. And then the last thing I'll just mention, the 4410 programs traditionally have welcomed families to come and tour their schools. If a child has received a placement, parent visits. There's been a lot of rumors and information that parents can no longer tour 4410 programs. Let me tell you, I made it very clear to the New York City DOE senior administration last week, that is unacceptable. That's a violation of parents' rights, I believe, under state law. I said that if a parent contacts the school and requests a visit, our schools will certainly allow the parents to visit the placements. I don't know how a parent can be informed and be able to make a decision about a child's placement if they haven't seen the school. And it's not reasonable to say that parents of students with disabilities aren't able to tour a school, but on the New York City DOE website, it very clearly shows under 3K for all and pre-K for all that they encourage parents to visit the sites before they place their children there. So hopefully I made it clear to the DOE that's our position. But I just wanted to say to the committee, if that comes up, parents should absolutely feel free to contact the school and ask that they want to tour the school. And most of our schools, I'm sure, will welcome the parents. So that's kind of a brief update right now.
Chris, you had a question?
Yes, one thing, Chris, I put something in your chat. If you left out one ruling, it's also a human rights law too. And a safety law too, because it does come into that human rights law. The other question that is still going on right now is the school bus issue, because right now we are affected with a heavy ridership of students who are in wheelchairs, walkers, and canes as well. We are having these issues because the accessory numbers has gone up 99% more, means it's up to the deepest red hot. It can explode. The problem is that the schools are not following the IEP procedure when a student needs to get to school. We still have that issue with travel training, because as of now, I'm like doing 80% of travel training. Thank God Accessoride is backing it up, and the Transit Museum. But at the same time also, the schools are not doing what they're supposed to be doing. And it's disturbing right now. And right now in Manhattan, because I'm looking in the bottom, Manhattan is actually tied with 3 boroughs right now with the highest number. And the problem is, you see there's a rally's been going on. We need to do something with them because September is around the corner. They need to understand that special ed students needs, District 75 or none, need the school buses to get them where they have to go. And this is very, very evil and very wrong. If you need to say evil, it is bad. And one thing I know a lot of these parents need to remember, if they're not going to let you in, then you have the choice of where you got to go, because it is disturbing this. I have to deal this issue on a transit point, on the transportation point, because we're in May and they have still not solved this issue. I can't blame 100% Adams, because this was the previous mayor. And right now he has to clean up all the mess and all the things we have to deal with. But at the same time also, we really got to remind them that, yes, you said you're going to help with accessibility, and I mean for seniors and disability. I'm waiting. So
yeah, they've had real challenges with transportation this year, Chris. I totally agree. And I know that, I mean, I've had a number of conversations with them around this. You know, we have preschool kids on the buses for 2.5 hours each way.
By 3.
And, you know, I tried to make it as clear as I can to them that that's really not acceptable. I'm hoping that they're going to have some plan in place for September that's going to show an improvement to what it is. I don't know, but it's a constant battle.
You know, like what I have to do, Chris, on the transit end, do the best we can, guys. But one thing I'm just going to remind everyone here, please do not blame the bus drivers, and especially the accessory drivers. We're doing the best we can, but the person we need to blame is the former mayor, because he needs to put the funding in for transportation. That mayor should have done it. He didn't make a promise to this, and it's very, very stressful to do the best we can. I'm glad the ridership is up, but not the way it should be.
Yep. Okay.
Thanks, Chris.
All right.
Moving on to committee reports. Manhattan Family Support Services Advisory Council, Mary or Jackie?
That was my quickest unmute yet. Good morning, everybody. I'm actually still reeling about the 50% under enrollment at the schools. That is just absolutely frightening to me. and sad because my son went there. A lot of people, it's an amazing education for the hardest kids. So just want to say that. As far as our committee, we are holding a meeting on May 24th at 10 a.m. on seizure recognition and first aid, which is a little bit outside our wheelhouse, but since it affects so many of the families that are part of our group, we decided that would be very good. And we've so far gotten a very good turnout for it. Mary has posted and will post again the link in the chat. I officially want to announce that Mary McGuire Weaver is our new Family Support Services statewide rep for Manhattan. We know she's going to do a wonderful job in the incredibly amazing footsteps of Margaret Punnington. And I think that's it, Mary. I think you wanted to add one thing. Mayor.
I was clicking the wrong button on the unmute button too. Sorry.
That's our specialty.
Okay, technically challenged. Yes, so I just want to also announce to families who are under the Medicaid waiver, Family Support Services contracts will, for Manhattan, reimburse for your camp out-of-pocket expense this year for this coming, if your child is going to camp this summer, if you submit any out-of-pocket expense prior to June 15th, so agencies can consider your reimbursement, that will be beneficial to a lot of families. You can email Jackie and I'll put our email in the chat with the 3 agencies in Manhattan that will reimburse for camp. That's all I have.
Thanks, Mary. Thanks, Jackie.
Hi, it's Susan. I don't think anybody has ever gotten full reimbursement for camp. Guys, I mean, you get something. The camp costs $3,000. Maybe if somebody would be very kind and give you $1,000, that's not going to pay for camp.
Well, some camps are, some camps will bill under the Medicaid waiver. So the balance, like for my son, is reimbursed fully.
Good. Didn't happen when Edward was little. So congratulations.
Just this year.
Well, good.
Thank you. Transition Committee, Andrew?
Hi, good morning. So our updates are last month, we called April Transition Month, and we sponsored a series of presentations with organizations that have programs and services for adults with IDD. And then we're hoping to finalize soon our June meeting, which will be the last one for the school year.
I haven't even got paid for it yet.
Thanks, Andrew. Family and Provider Information Committee, Yesenia, Louisa.
Hi, it's me again. I think Luisa's not in today. We had a meeting last week and it went really well. I want to thank Wendy, Carol, and Terry from ADAPT, who were our presenters on housing advocacy and housing choices for people with developmental disabilities. And I just want to mention the fair, which you mentioned, Kathy, at the beginning of the meeting. Again, it's June 14, and everybody should be receiving a link soon. We are planning to use translation, and I just also want to say I'm getting a few emails from participants of this meeting regarding the directory. Please keep them coming because I am updating the information as I receive the emails. So thank you so much to those that reach out. And that's it.
Thanks, Yesenia. Jim, any update on legislative?
Not really. I mean, Tom and Chris brought us up to date on most issues, both Chris's actually. So thank you. I don't have anything else on there. I don't know if anybody else has any questions on it. Ellie, maybe? No? Okay.
Thanks, Jim. Margaret, do we have a report for nominating committee?
Well, it's the same as last time. nominating committee put forth a slate, which is basic, it's for chair, Kathy Kelly, for vice chair, I don't have this in front of me, I hope I can remember. It's Carol Lincoln. For parent vice chair, it's Kelly Roofer. For secretary, it's Alana Katz. For treasurer, it's Jesse Backey. I think that's it. No one has contacted me. Again, if you would like to nominate yourself or somebody else, feel free to contact me. And the election will be held next month in June.
Thanks, Margaret. Any other, Ellie?
Yeah, if no one minds, I want to share a personal thing because I think it's important that we thank every human being that touches our family member right now in any way possible, financial, thank you, a note, it doesn't matter. My daughter had surgery recently and she's fine. Well, relatively fine, you know, because it didn't cure her. It was just she needed a shunt put in her head. And it's successful so far and all of that. But what it reminded me that we can't do this alone. So the family members can't do it alone. The providers can't do it without families. The nurses can't do it without, and the need for communication and everybody on the same page is essential. And while everything worked out fine, and I'm not complaining about a thing, there are many things that we can do to improve the system of how things get done. And so at some point I will write up Katie's experience, but I just want to, everybody should right now write an email to whoever touches your kid and say, thank you for doing it. And then, you know, it's fundraising season, so I'm not, you know, buy them dinner, you know, send dinner into the house if your kid's in a residence. Just do something. Because I'm 76 years old and I am so grateful that I didn't have to sit in a hospital room 24/7. So, you know, just take a deep breath and enjoy the beautiful day and say thank you. That's all.
Thank you, Ellie. And, you know, just to double on that.
Susan wants to talk.
Okay, hold on, Susan. I'll get to you in a second. You just can never underestimate the power of gratitude and a thank you. And, you know, coming from a former direct support professional and working in residential as well as day services, the ones that count the most are the ones from the people we support and their families. So please continue to take that opportunity to thank them. Susan?
I couldn't agree more. And what we are doing at Edwards House is we're having a thank you lunch on Friday for all the staff. They're coming, they've been invited. 2 former managers of Edwards House have been invited and they're coming. And all the staff from morning, evening, you know, whenever they are coming. Edward also had 10 days in the hospital with one-on-one care from his house, which aside from 1 or 2 wrinkles was pretty wonderful and pretty amazing that they were able to come in this very difficult staffing time. And I was thrilled to have them there. Even saw one person who now works at the hospital who used to work with Edward. She was so glad to be with Edward again. And it is, they are incredible. They are absolutely incredible.
So we shouldn't wait for an emergency to tell them.
Oh God, exactly. That's why we're having a nice spring lunch on Friday.
Good.
It's organized by another parent whose son lives in Edwards House. And we're all contributing something. Looking forward to it.
Enjoy. Chris, you had another comment?
Yeah, well, one thing I have two, because we added, I agree with both ladies. We do need to thank you, a lot of the staffs, even from doing surgery, who's doing, or even doing this COVID pandemic, because they were there to help them, encourage them not to be so worried, don't be so stressed right now. We do want to thank them as well. But now going to a different comment now. I have received a couple of chats asking me this question. How can we put in complaints for the MTA? I put in the chat just a few minutes ago. There is a link for, you can actually do it faster. And this is for Access-a-Ride as well as any MTA. You can just go onto the My MTA website with comment and feedback and get the reference number. If it's an accessibility complaint, once you get that reference number, you can email it to the system-wide accessibility, so it's really being investigated. And there are times I have to go out and investigate it too at certain areas. So those are the things I did put in the chat as well. But we do want to thank everyone who have been doing the COVID, even hurricanes, severe blizzard storms. We do want to thank every person. Thank you.
Thanks, Chris. Anything else? Then on that note, thank you to all and each and every one of you for staying tuned and keeping up with the advocacy and for hanging with us all throughout this pandemic. Hopefully we'll be back to in-person meetings in the very near future. So thank you and enjoy the beautiful spring day. Have a great day.